When you think about a bicycle, what's the first thing that pops into your head? For me, it's that feeling of freedom, maybe learning to ride without training wheels, or just a quiet ride on a Sunday. It's such a simple machine, right? But it holds so much meaning for so many of us.
So yeah, on one hand, a bike is pretty straightforward. It's transportation, it's recreation, it's a hobby. But what if we flip that on its head? What if that exact same bike could be prescribed, like medicine? What if it could be the very thing that connects a community, or even becomes a lifeline for someone who feels totally alone? And that is the big question we're diving into today. We're going to look at how this incredibly simple machine is being turned into a seriously powerful tool for health, for connection, and for healing. All right, so our first stop is Boston. A bunch of hospitals there are running this amazing citywide experiment. They're basically weaving bicycles into how they care for the community, and they're doing it in some really creative ways. First up is the Prescribe a Bike program. Now get this, you go to your doctor and you walk out with a prescription for a bike. They are literally giving out free memberships to the city's bike share system. And this is the key part. It's not just about getting some exercise. For a lot of people, this is essential transportation. It gets them to work, to the grocery store. It connects them to a healthier life in every sense of the word. Then you've got Build a Bike, which honestly I think is just brilliant. It's set up as a team building day for hospital staff, but instead of doing, trust falls, they're actually building brand new bikes. And those bikes, they go straight to local kids who need them. It's such a cool way to bake generosity right into the hospital's own culture. They also have the Blue Bikes program. And the genius here is just how simple it is. I mean, think about it. Being at a hospital with a loved one can be incredibly stressful. This program gives families a way to just escape for a bit. A quick, easy ride to a park or to grab a coffee. It's this little dose of normal life and fresh air right when they need it the most. And of course, the last piece of the puzzle in Boston is all about safety. Through the Injury-Free Boston Coalition, they focus on preventing injuries before they happen, like handing out helmets to kids. Because look, if you're going to encourage an entire city to start biking more, you absolutely have to be thinking about how to keep them safe. So Boston gives us this fantastic, big picture view of what's possible. But it brings up a really important question. How do you go from these broad, citywide initiatives to something super targeted, something designed to solve a very specific and complex problem, like veteran isolation? And that leads us right to our main case study today. We're looking at a program that answers that exact question by zeroing in on the unique challenges faced by military veterans, specifically that feeling of isolation and just their overall well-being. It's called the Veteran Virtual Ride Cohort, and here's the one-sentence breakdown. It's a 12-week indoor cycling program that uses smart tech to bring veterans together for workouts that are supported by their peers. It's built from the ground up to improve health and create community, all without anyone having to leave their home. So why this focus on veterans? Well, because the need is it's urgent. Veterans often face a really tough road after their service. We're talking about higher rates of social isolation, depression, chronic health problems. And on top of all that, you have real-world barriers like bad weather or just not having a way to get to a gym. Staying active can feel impossible. This program was designed to knock down every single one of those barriers. Okay, so we totally get the why now. So let's pull back the curtain and look at the how. We're going to break down the actual blueprint of the program to see what makes it tick. The real magic here is how these 5 pieces click together. It all starts with safe, low-impact cardio. But, and this is what makes it so special, that exercise comes with trauma-informed peer support. So it's not just a workout class, it's more like a support group on wheels. It's all powered by virtual tech, like Zwift and smart trainers, which lets everyone connect from wherever they are and allows the program to track real, measurable results. And the plan to get this thing off the ground? It's beautifully straightforward. It's just a 5-month cycle. Month 1 is all about setup. Months 2, 3, and 4 are the 12-week program itself. And then month 5 is for evaluation. It's a clean, simple, and totally repeatable model. Now this is where things get really interesting. Take a look at that budget. For just a little over $10,000, you can get a pilot program up and running for an entire group. I mean, in a world where veteran services are so often underfunded, a lean, efficient model like this isn't just scalable, it's a potential game changer. A great plan is one thing, but impact is what it's all about. And this program is all about measuring what truly matters. Not just physical health, but also that sense of connection, and of course, mood. First up, the physical goal.
They're aiming for 75% of the vets to increase their active minutes by at least a quarter each week. That's not just some random number. That's a direct, tangible improvement in their physical health. That's a huge deal.
But remember, this was never just about the exercise. The goal here is for 70% of participants to actually feel a stronger sense of belonging. This hits that core problem of social isolation right on the head. It's about rebuilding that sense of camaraderie they once had.
And finally, it all ties into mental well-being. The target is for 60% of veterans to report real improvement in their mood scores. This is where you see the physical activity and the social bonding come together to make a real, measurable difference in their mental health.
And their tagline? Wow. Ride together, heal together, move forward. It just perfectly captures the whole spirit of the program, doesn't it? The journey is shared, the healing is done as a team, and the focus is always on looking ahead.
So when you zoom out, what's the big takeaway here? This isn't just one cool little program. It's a blueprint. Because it's virtual, it can reach veterans in rural areas who might otherwise be left out. It can break through the deep isolation of those long winter months. And because it's so affordable, it's a model that could be picked up and used almost anywhere.
And that really leaves us with one final thought to chew on. We've seen how a simple, everyday bicycle can be completely reimagined into a tool for healing and connection. And it just makes you wonder, right? What other everyday objects sitting right there in plain sight are just waiting for us to unlock their potential as powerful tools for community health?